Millions of public sector workers, including civil servants, prison staff, military personnel and some NHS staff, will get a below-inflation pay rise of 1% from April this year. But the government is not giving an across-the-board rise. About 600,000 NHS staff who receive annual rises in so-called increments won't get it. There are also the government pays for public sector pensions, with individual departments picking up the bill. Some union members are angry, and there are some threats of industrial action, as our political correspondent Vicky Young reports.
Like all family households, Angela's bills stack up. She's a senior nurse on a busy hospital ward, and she's just discovered she won't be getting the salary rise she was expecting. She's angry about today's announcement and says staff feel totally undervalued.
It's just disappointing, upsetting. Does it really want to make you get up out of bed and do a 12.5-hour shift? When you're not going to be rewarded sufficiently, it hurts. It really hurts.
Like Angela, more than half of NHS workers receive an incremental, regular pay increase as they gain experience. The official advice to ministers was that staff should get this plus a 1% salary rise. But the government says it's got to be one or the other.
I would dearly like to be more generous, but not if it means, which I think it would mean if we accepted this pay review body recommendation, that we had to lay off around 6,000 nurses. And that is the risk we take. And what nurses up and down the country say to me when I go out on the front line is the single thing that matters most to them is to have enough people on the wards.
And what about other public sector workers? Ministers have decided that members of the armed forces, prison officers and judges should all receive a 1% rise, well below the rate of inflation. In recent months, we've all been hearing much more positive news about the economy, but ministers have remained cautious, talking about a slow recovery. And today's announcement is a sign that they've no intention of going on a spending spree. The years of pay restraint are far from over. And that's infuriated the unions, who say it'll mean a further cut in living standards for public sector workers. Consult their members over strike action.
It shows complete and utter contempt, not just for the NHS workforce, but for the NHS. Because if you have a demoralised and demotivated workforce, that can't be good for patients. And so we feel this really shows the government in their true colours. We hadn't expected them to pick a fight with the NHS before the general election, but that looks like that's what they're trying to do. And if that's what they want, that's what they'll get.
Wales and Northern Ireland are still considering the pay awards, and in Scotland there will be a more generous offer for health staff. But in England, despite the hostile reaction, the government insists reform of NHS pay is essential. Vicky Young, BBC News.
Well, we can speak now to Sam Bowman, the research director for the free market think tank, the Adam Smith Institute, who's in our central London studio. Thanks very much indeed for joining us, Mr. Bowman. What do you make of today's announcement then by Jeremy Hunt?
Well, I think it's important to remember the point of the NHS is to provide good care to patients, not to provide welfare to people working for the NHS. The question really all of us should be asking is, what's the best use of the limited funds we have available to us? Now, Jeremy Hunt has said that granting this 1% pay rise across the board would cost the jobs of 6,000 nurses. Now, I don't know where the resources are best directed, but there's definitely a trade-off there. What I think really should happen is that the decision should be devolved down to NHS trusts, so that individual trusts can make the decision for themselves whether they think the money best is going to help patients by going to wages or by going to jobs.
Well, of course, it's not a welfare scheme for National Health Service staff, but nobody's going to work there for nothing, are they?
Well, no, but you have to remember that in the private sector, everybody has been taking real terms pay cuts since 2010. The public sector has actually done relatively quite well since 2010, and although nobody's having it well, nobody's having it easy, it's important to put this kind of thing in perspective. Job security is much higher in the public sector than in the private sector, and I'm not sure why people in the public sector should pay increases when people in the private sector who are paying those taxes aren't getting that. We have to keep this thing in perspective, and we have to remember funds are limited. It can go on a wage increase, or it can go on things like staff payment, jobs and equipment for hospitals. I don't think that this should be a political matter, and I do think it should be devolved down to individual NHS trusts to decide.
Fine, but unions would argue that the comparison between private sector pay and public sector pay is misleading because many in the public sector are more qualified than those in the private sector on equivalent scales.
Well, that's true, but even qualified people in the private sector have taken real terms pay cuts since 2010. Almost everybody has taken real terms pay cuts. This is not just something that's affected low-skilled workers, it's affected people across the board. The economy in general is hurting, everybody knows that, and I think it's very difficult to say that above the incremental pay rises that are already agreed on that nurses and NHS workers will be getting, they should also be getting this extra 1%. The money isn't there. People in the private sector are having to make cutbacks. I think it's fair, and I think it's the efficient thing to do to make people in the NHS do the same.
Sam Bowman, Adam Smith Institute's Research Director, thank you.
Thank you.
The headlines now with the time at 18 minutes past 8.